We know that cancer is one of the commonest diseases in adults. We also know that by detecting cancer early, we can give the best treatment options and lead to the successful curative outcome. So screening is something that we do before a patient presents with any symptoms. For example, a breast cancer patient, if they have a breast lump that is more than 1 centimeter, that is when they can start to feel a lump in their breast. That's when they would come to the doctor and explain their problems. However, if we would invite the patients to come forward for a mammogram, which is the screening test for breast cancer, we could easily detect cancer as small as 0.1, 0.2 centimeters. So in this analogy, the person who came with a tumor that is only 0.1, 0.2 centimeters large compared to the one that comes with 2, 3 centimeters large, the chances of curing the first one is much better. There are various tests we can test for certain cancers. Different cancers will require different tests. And we also have standard recommended routine tests that we do. These are for women who are above the age of 40. We would recommend them to come for mammogram to look for breast cancer. For all sexually active women above the age of 21, we would also routinely recommend pap smear test to look for cervical cancer. For both men and women above the age of 40, we would also encourage them to come for colonoscopy to look for bowel cancer. Those are the standard recommended screening tests for all the people in the population. However, when someone has certain risk factors, for example, people who have cirrhosis, who had alcohol, very high intake of alcohol, there might be a risk of liver cancer. These are the group we would invite to come for liver cancer screening. People who smoked, who are at higher risk of getting lung cancer, we would invite them to come for low-dose CT scan screening. There are various different cancers that only apply to certain high-risk group. That's when we would do certain tests on them. The reason for that is because tests are good, however, there are also side effects and we do not want to expose patients to them unnecessarily. We recommend all women above the age of 40 to come for breast screening. There are many tests that we could do for breast cancer. The most common one for women above the age of 40 is a mammogram. This is an X-ray of the breast. It looks at any calcifications, any tumors in the breast. Other forms of tests that we have are ultrasound scans. This involves ultrasound of the breast. We usually recommend this for women below the age of 40. That's because women below the age of 40 have glandular breasts and X-ray does not detect lumps as well as ultrasound scan. The other method is MRI. This is magnetic form of imaging and it's very sensitive. That means it will discover any abnormalities, be it cancer or not cancer. So the disadvantage for that would be if it's not cancer, we would move on to do more invasive tests for the breast. So what are the invasive tests we do when necessary? That is to do a biopsy of the abnormalities that we detect in any form of imaging that we mentioned earlier. So biopsy enables us to look at the actual cell. These cells are analyzed. If they were malignant, in other words cancerous, then it will give us additional information what is the best treatment option for them. So colon cancer, or in other words for it is bowel cancer, is very common in both men and women in the world. It's usually in the developed country. That's to do with our diet and our lifestyle. So we would routinely recommend both men and women above the age of 40 to come for colonoscopy. This is the gold standard for looking for bowel cancer. This involves a gastroenterologist or a surgeon putting a tube back from the back passage to look at the entire colon or the bowel. Two things can be achieved by this method. One is therapeutic, that means it's treatment. So if it's a simple polyps, the person who is doing the procedure could remove the polyps and that's the end of the problems. Or diagnostic, this is when something is quite abnormal, they could not remove it completely. They'll take a tissue sample. This tissue can be sent to the lab for analysis. Then the pathologist will tell us if this is cancerous or non-cancerous and what action is to be taken from there will be decided upon. Cervical cancer is a form of cancer that is most commonly transmitted by sexual activities. So we would recommend all women above the age of 21 who are sexually active to come for cervical pap smear test. This involves a gynecologist who look into the cervix area, and a sample of tissues can be obtained. These cells are being sent to the lab for analysis. So if it's cancerous, again, we would know what to do about it, or if it's non-cancerous, we might ask the patient to come back in 3-6 months' time to re-examine again. What I have mentioned earlier are routine standard recommendations. The reason for that is they are common cancers. We have effective tools to discover this cancer early. We also have effective treatment to treat these cancers properly and curatively when discovered early. However, there are other cancers that are not so common. We need to identify the group of patients who are at high risk of getting this cancer. These are liver cancer, lung cancer, ovarian cancer, and gastric cancer. In conclusion, I'd like to encourage everyone to come for cancer screening. As mentioned earlier, cancer is a very common disease in adults, but if detected early, it's very curative with current technologies and treatments that we have. Do not be afraid to come, because it can either give you a peace of mind when you found out there's nothing wrong with you, or that if something was unfortunately wrong, we could detect early, we can lead to cure and successful treatment.